Homeopathy has a lot of emphasis on mind and all that, agreed. But my first suggestion to you all would be understand what is the chief complaint. And why to understand what is the chief complaint is to come to a diagnosis. This is fundamental. I never take a case now unless the case is not diagnosed. Either if I cannot diagnose, then I tell the patient that you better go to a specialist and get yourself diagnosed. It is very important to establish a diagnosis, which we all have learned in our college days, that why diagnosis is important, and primary reason is to understand the prognosis. And patients do tend to ask how much chances we have. Every case that will come to you will ask, will it get better? And without a diagnosis, we will not be in the position to give them the exact answer. And what I have seen in my practice is, it is not what remedies that we give to patients that matters, but it is how we are dealing with them. Are we telling them the right thing? Are we guiding them on the right path? Secondly, diagnosis is also important, is to understand where the pathology lies for us to think of remedies. I'm not saying that you have to give those remedies, but for us to think of remedies. So for example, if the patient has problem with the coryza and it's an acute coryza, then you think of Allium cepa first, belladonna first, simple remedies, dulcamara first. If the problem is located in the throat, in the pharynx, or in the tonsils, then you think of Hepar sulf, belladonna. If the problem is located in the chest, then you think of ferrum phos, you think of ipecac, osimum can. So you get some idea as to where the case is going or what remedies you can think of. These are some things which can help us with when the diagnosis is clear. Where is the problem? Location, which we all know is very important, but we don't give attention. But we have to give attention, because suppose if a patient of migraine comes and the patient says that I have an acute throbbing right-sided pain. Now, the first remedy that we have to think in our mind is it could be belladonna. And that can only happen if we pay attention to the location. If we just say, okay, patient has migraine, okay, forget the migraine, tell me what are you feeling because of it? Oh, I feel very angry and I want to bang things, I want to throw things. This all comes later. I feel this idea of location, sensation, modality, and concomitant is like a fundamental, it's like a foundation. When you build a house, you need a foundation in terms of bricks and cement. These aspects, these physical complaints, they lay the foundation of a house, of a home. And once all that foundation is complete in terms of location, sensation, modality, concomitant, ODP, past history, family history, physical generals, then comes the mind. The mind forms the interior decoration, of the house, where, the fundamental is clear, the house is all set. Now you think how you want your bedroom to be, how you want your hall to be, how you want your kitchen to be.